should I screen my wife before I marry them for stroke? How accessible, how cheap, how expensive are these CT scans?
Unfortunately, those three are culprits when we are talking about non-communicable diseases.
Is stroke preventable? Every 2 seconds, someone somewhere in the world is struck by a silent storm. This leaves tragedy and it creates emergency in so many families. It can come without any warning, stealing speech, movement, memory, or even life itself. More than 1 million people suffer a stroke each year globally, and nearly 6 million people will not survive each time it strikes. For those who do, life may never look the same again. But here is the truth that can save millions. Stroke is largely preventable, and its damage is greatly reduced with every intervention. With fast action, within the golden hours, lives can be saved and futures restored. It's not just about treatment. It's about recognizing the signs, acting without delay, and building systems that respond rapidly to emergencies. I mean at health facilities. Stroke is no longer just a disease of the elderly, the rich, or a problem of one region, race, or gender. It is a global health crisis. Yet it still kills a lot of people, even with the vast knowledge and information that has been produced so far. To raise awareness, inspire action, and empower individuals and the community to fight back is one reason we are going to discuss about stroke this afternoon. The clock is ticking. Let's turn the tide. One life, 1 minute, one choice at a time. Good afternoon, friends, wherever you're watching us from. My name is Mr. Selfcare, and we are going to talk about stroke. This program is for family that has someone that was diagnosed with stroke. It is also meant for someone who was told they have risk factors for stroke. We are joined by two great minds, two great knowledgeable people that are going to be discussing with us today. But before, if you're there and you have not yet subscribed, I kindly ask you to subscribe, comment, and remember to share this video with someone that you think it may be beneficial to.
Yes, good morning, our viewers. My name is Flavia Nalvega, and I'm a public health specialist. And I'm excited about the non-communicable diseases. So I'm happy to be here with you sharing this topic. Thank you.
Good morning. Good morning, our viewers and everyone watching. Thank you for being around and subscribing and liking this page. My name is Kaganda Julius. I'm a qualified medical radiographer. I'm so excited to be with you and we learn together.
Thank you. Again, if you're here for the very first time, we kind of ask you to subscribe, like, and comment. Let's start at this page. Madam Flavia, what is stroke exactly and how does it occur?
I think I would simply define or explain stroke as a medical emergency that would interrupt, where there's an interruption in the blood circulation in your brain, in one's brain. And usually this interruption leads to a reduction in the oxygen supply to the brain cells. And unfortunately, sometimes if this is for a prolonged time, the brain cells may dead and leading to a permanent damage. Yeah, I think that
Can
is how I
you can
damage.
you explain this in any local language that you understand, such that if there is any viewer who does not understand English, they properly, especially understand the definition?
Let me try in Luganda.
Okay.
Stroke eringa embeera oba obulwadde obwetaaga immediate attention in trying to make sure that it's actually an emergency nga mu kiseera kino obwongo bubeera tebukyafuna bulungi musaayi gulimu oxygen ogugutuukako kuba tumanyi buli cell mu mubiri gwaffe yeetaaga oxygen to live. Kakati obwongo bwe bubeera mu mbeera nga tebukyafuna omusaayi guno ogulina okuleeta oxygen nga gusaliddwako nga tugamba nti omuntu ali mu kugenda mu stroke oba ali mu stroke. Omusaayi guba tegutuuka
Okay.
bulungi ku cells. Waliwo portion mu bwongo nga teri mu kufuna bulungi musaayi guno.
Okay. So it is basically a condition where the brain cells are not getting enough blood supply. Okay.
There's an interruption in circulation.
Okay. So what are the different types of stroke, and how does each of these occur?
When we talk about types, we look at mainly two types. There's the ischemic stroke and then the hemorrhagic stroke, but these two are still further broken down depending on how they are occurring or where they are actually occurring. Let me start with the ischemic stroke. So when there is ischemic stroke, here there is a blood clot that is blocking the blood supply to a particular portion of the brain cells. And this blockage can be due to either one, a clot that has been formed in the brain arteries. And here, this is going to be referred to as the thrombotic stroke. Here, the blood clot is being formed in the brain arteries themselves. The other one would be the embolic stroke. And here, the blood clot can travel from any part of the body. And then, as circulation happens in the body, it finds itself in the brain. This is when we refer to it as the what? The embolic stroke. Yes.
Okay. You've used a lot of terms. I hope our viewers can clearly understand. So,
Actually,
Flav,
actually, I only gave the portion for the ischemic stroke, but there is also hemorrhagic stroke, and
yes,
here there is a bleeding.
yes.
The ischemic
Bec-
stroke that we talked about has two. The hemorrhagic stroke has two as well. Hemorrhage to mean there is a bleeding somewhere that is causing this stroke. And this bleeding may one be happening in the brain itself, within the
yeah,
brain, and here we will call it the intracerebral stroke.
yes.
But two, this bleeding can happen outside the brain. We have some layers, some two layers that cover the brain, the subarachnoid. There's space there. So if the bleeding is happening in between those layers where we have the space, then we refer to that as the subarachnoid stroke.
Yeah, because that's where I was coming. Being a person that likes so much to work with accident and emergency patients, I really wanted to ask what's the relationship between traumatic accidents and stroke. Do we have some stroke that's actually caused by traumatic or whatever? And that's, I think that's what you're saying, that this time the brain is not getting blood because there is a bigger bleeding somewhere happening, right?
It can be a bigger bleeding, it can be a blockage due to
Okay.
an clot.
Okay. What are some of the main warning signs for someone to recognize that they have stroke?
Some of the warning signs here, we are going to look at different parts of the body or different aspects of an individual. First, we are going to look at their balance. Their balance may be altered a bit. And if we are looking at them and we probably have a history of their medical their medical background or anything else, then we may start suspecting. Then also we may start complaining of either a blurring in their vision, or they are seeing they have double vision, they are seeing two in one, or they may completely lose their vision. Then we consider this as as a warning sign. Then another one is going to be their arms. We look at their arms. You may tell someone to either lift their hands up, both of them at the same time, or you lift them up. And in case you notice a drooping in one of them, of the hands, that is not conscious, the person is not consciously doing that, then we may start getting ideas that maybe they are actually going into a stroke. Then the simplest of statements, or it is starting to get slurred a bit. The words are not coming out like they should be. Someone may be talking to you like I'm talking to now, and then all of a sudden the words they are slower, they are mumbled, they are not clear. Then you start getting worried that this person may actually be going into a stroke. Then also you may look at their face. You may look at their face, and when you tell them to smile, you notice there is a part that is a bit drooping, a side of their face that is drooping. All these signs, when you look at them and you have a history of the person, maybe their age, their underlying conditions, their previous illnesses, their history, then you start getting worried that this person may actually be getting into a stroke, and then you make sure immediate medical attention is sought.
Can you try to, in local language, to go through the signs obubonero bwa stroke, because abantu bangi eyo bannaffe abawuliza nga oluzungu tebalutegeera naye nga balina abantu be balowooza nti bayinza okuba balina obulwadde bwa stroke. Gye twakuyanga bw'olaba omuntu ng'esayidi emu either eriiso lizibirira oba omumwa gugira oba ki, immediately twaba diagnosing nga nti balina stroke. Nsaba obubonero obwo obwa stroke obuyitemu mu lulimi Oluganda, n'omulabi waffe ategeera Oluganda obulungi aleme kusubwa paati eno. Yes, please.
Kangezeeko. So ekisooka kye twagambye ekya balance, oyinza okulaba omuntu nga tabalansinga bulungi oba tatengerera bulungi, oba olumu oyinza omugamba okutambula mu straight line nga tasobola kubeera nga maintaininga posture eyo. Ndowooza bwe nnyinza okinnyonnyola, nga tasobola kimaintaininga bulungi. Then n'ekirala kye tugambye nti amaaso ge, ayinza okugamba amaaso either tegakyalaba, oba nga byalaba biringa ebiriko olufu, oba ng'alaba bibiri mu omu. Omuntu mubadde mutudde awo ogenda olaba ng'akugamba amaaso gange simanyi kigabaddeko, n'akunnyonnyola engeri gye galimu, ng'otandika okwekengera nti omuntu ono ayinza okuba agenda mu stroke. Then n'ekya face kye twogeddeko ky'oba okunnyonnyola ekya face kiringa ekitali coordinate, nga kiringa ekitakwatagana bulungi, nga for example omugambye okusmilinga ng'olaba side emu smile eri mu kuvaayo bulungi, naye nga side endala eringa nga oba muscles ezitakyakwatagana oba ebitakyategerekeka, naye nga tali mu kikola ye kennyini ng'omuntu, nga kiri mu kwekola kyokka. Awo ng'era otandika okweraliikirira. Then n'ekirala kye tugambye ekya speech. Speech eno omuntu nti mbadde njogera naawe, ogenda okulaba ng'abadde ayogera obulungi, ebigambo bivaayo bitandise okwenyoola, tebiri clear ninga omwana omuto, nga tebitegeerekeka, nga speech eri mu ggenda. ng'otandika okweraliikirako nako kasobola okubeera akabonero k'olabira nti omuntu ono alabika agenda mu stroke. Then oyinza n'omugamba okuwanika emikono gyombi omulundi gumu, oba gwe kennyini n'ogiwanika ng'olina kyekengedde, olina ky'oyagala okukebera, n'ogiwanika n'olaba ng'ogumu gulina engeri gye gugwamu naye nga si yakikoze ye kennyini. Ekyo nakyo kituleetera okutandika okweraliikirira bwe tuba tugasseeko ebintu ebirala bye tumumanyiiko. Oyinza okuba omuntu ono omumanyi oba wa pressure, oba alina sukaali, oba yafunye accident jjo, ebintu ebyo bwe biti ebimu. Bw'obigattagatta kitandika okweraliikiriza oba okulowoozesa nti omuntu ono ayinza okuba ali mu kugenda mu stroke. Ne kikuleetera okumakinga sure nti afuna obujjanjabi amangu ddala.
Okay. Who is at risk of getting this stroke again? Who are the people at risk?
So when we are looking at people at risk, there are some risk factors that are attributed to behavioral I should say. They are attributed to our behaviors, some of the things that we choose to do. For example, people engaged in smoking, alcohol use, illicit drug abuse, people that use ebiragalalagala. Then we can also look at physical inactivity. It can also put you at risk. Then waliwo ne risk factors endala nga zo zisinziira ku birwadde omuntu byasangibwa nabyo. For example, hypertension, people that are hypertensive are at a risk of getting stroke, especially the hemorrhagic type. Then also people that are having diabetes, then people with sickle cell disease, and then also people that have aneurysms. Mulimu abantu abamu ng'omusuwa gulina engeri gye guzimbamuko ne gukola nga kabbaluuni nga gwenlargins at a certain section. That is what we would call an aneurysm. Nti essaawa yonna yonna omuntu ono, in case this aneurysm bursts, we may see ourselves treating hemorrhagic stroke in that person. Then there's another cause, gye wabadde oyogeddeko, trauma. Someone can get trauma and then it predisposes them to a future stroke. So those are some of the risks factors that I could point out that we need to look out for or attend to in order to prevent this in the future.
Yeah, maybe someone that has that may not and may struggling to understand what aneurysm is. We have small blood vessels called arteries that actually take blood from the heart to all the other blood vessels. Now, some of them are bigger blood vessels, especially the thoracic and abdominal aorta. Now, sometimes there is a tendency of this aorta to form like a balloon in some areas. And so when it happens and maybe it's not detected, sometimes it will have things like you'll see your abdomen swelling in certain position. Now, when it happens and maybe something happens and it bursts, that's why she was explaining that we may have what we call now hemorrhagic stroke. How this is detected, we normally, most of the time actually, aneurysms are accidentally detected. Someone goes for totally another scan, and then the sonographers take some measurements and they realize that actually maybe this blood vessel has ballooned in certain situation. And normally this is an emergency situation each time we detect an aneurysm that measures beyond certain measurements. I think normally they say bwebanga kazimbye okusuka centimeters 5, normally it is an emergency situation. So again, we want to thank you for watching, and we say if you're here and you've not yet subscribed, please subscribe and make it a point to be here every Wednesday at 1 p.m., but also Sunday morning for a live show with different health professionals. Flavia, how much, in case I have a patient at home, I have my relative, and then I start to see some of these signs, how much time do I have between when I see the signs to hospital. Mr. Julius from the radiology department. Talking about stroke, as my learned friend from the imaging department, how do you handle this stroke? Normally, which people request for this type of scans, and what do you normally do in the imaging? Like, what's the best modality for that and why?
There are different kind of patients who asks who come in our department as the in the imaging department.
Yes.
These patients are sent by doctors after being reviewed
Yes.
of what has happened
Yes.
before they enter the hospital.
Mm.
So they come with a request
Yes.
form, usually in a CT department, in case the doctor requests for an investigation. Now,
Yes.
for them to come in our department, they will come with a request form being
Yes.
requested by the doctor that this patient, so and so, let me say Kaganda Julius,
Yes.
is in need of a CT scan. So they will come with a request form of a CT scan
In
with
other
the
words,
history. Usually, just
mm. In other words, sisobola
just as
kuva.
doctor has been explaining,
Yes. Sisobola kuva buvi waka ne
just
ntambula
just as
butambuzi. Sisobola kuva waka ne nzija buzipaka ku city department nega Mr. Julius nze nzize kukola CT scan.
no. In the hospital we have a protocol we follow.
Yes.
Because you can't just come and it's like self-prescribing yourself medicine,
Yes.
which may not need, because this department you are entering in, it is full of radiation. So we give a dose or we do a CT scan depending on how the doctors asked, on how the patient is presenting him or herself to the doctor's side after being reviewed, because CT is using radiation in it. So
Okay.
we are protecting the patient from radiation.
Okay,
That's why
Mr.
they have to
Julius.
come with a request form to guide us.
Yes. So, Mr. Julius, take us through. In the radiology department where you work, we have ultrasound, we have X-ray, we have MRI, we have CT scan. And in your explanation, you talked about CT,
Yes.
meaning what is the best imaging modality for diagnosing a stroke?
The best imaging modality would be CT and MRI.
Okay.
That's why Dr. When she was explaining,
Yes.
she took you through the types of strokes, how the patient present. So some
Yes.
patients may come due to trauma, that is that ER,
Yes.
so they be reviewed. Some may not be due to trauma.
Yes.
Some could be in the bracket of ischemic stroke.
Yes.
So for the
Yes.
doctor to get to know which type of stroke does this person is suffering from,
Yes.
the area where this stroke is,
Yes.
for them to get to know, that's when the role of the CT scan comes in place. Because
Oh.
us, as the imaging department, we go deeper to
Okay.
see the site and the kind of the stroke the patient is suffering from.
Oh, in other words, omulwadde ono bw'ajja mu CT scan, omugaso gwa CT scan kubuulira ekisooka abasawo baba bamwekebejjezza ne bapima ebintu eby'enjawulo ne bagamba nti ono ayinza okuba alina stroke. Kaakati bamuweereza erimu abakugu mu radiology to confirm ekisooka oba kituufu omuntu ono alina stroke. Ekyokubiri bw'aba alina stroke, alina kika ki ekya stroke era eriridda wa?
Yes.
Okay, Mr. Julius, what are the preparations? Singa jajja wange oba omuntu yenna ewange baba bamusaba ekifaananyi kya CT stroke, kya CT scan. Preparation alina kwepreparinga atya nga tannajja mu CT scan yene ya stroke?
By the time the patient comes to the department, They have already done the process of triaging and everything from the ER department.
Yes.
So the patient comes in our department. Usually we do a non-contrasted CT scan first, because in that CT scan the patient may not need to be prepared in the department. So the patient will just come in our department, we look through the request form, then we put them in the machine and we start scanning. Since it's a non-contrasted CT scan, the immediate examination we can do.
Okay. So
Yes.
abatamanyi oba abagezaako okuimagininga ekyuma kya CT scan bwe kifaanana. Ekyuma kya CT scan kiringa kayumba weebaka ne bakuyingizaamu. Mr. Julius, before I let you go, what are some of waliwo abantu, for example, we tuba tugenda mu x-ray batugamba ab'embuto tebayingirayo, and earlier on you spoke about radiation. CT scan and radiation. Abakyala b'embuto mubakolera ki in that incident? Senga oli abanga basawo bamu diagnosing nze yeetaaga CT scan to rule out stroke naye ng'ali lubuto, mubakola mutya?
Usually when such patients come in our department, we examine them.
Okay.
We ask them, especially people in childbearing age, we ask them their last days of their menstruation to get to track. And also we ask them, we have what we call a questionnaire to ask
Yes.
them to get to know their last menstruation period, to get to know whether they are expecting. And also in our department, we have radiation signs for
Yes.
expecting mothers. Sometimes, okay, the patient may come and you don't ask, but the patient will see the signs of radiation to warn them of where they are entering. And in case a patient is expecting,
Yes.
we don't put them into radiation, since this radiation is so harmful to the baby and also to the mom.
So, in other words, I think that now there is a dilemma. This patient needs a CT scan to rule out stroke, but is also pregnant. I think I think maybe you consult their physicians to see, because now I think now you outweigh, because there is maybe sometimes they will say, okay, let us maybe use protective measures or shields to cover to make sure this patient goes.
It depends also on the type of the age of the pregnancy.
Okay.
So in the first trimester, it may be tricky that we cannot put in the patient. But between second trimester and third, there we can use protective measures after consulting their physician and also the patient accepting, such that we can put them in radiation. Since we are going to be monitoring the head, we protect the other part of the body with the protective measures such as lead jackets and the rest and lead apron, since we are dealing with the head up.
Yeah. Lastly, before you go, how accessible, how cheap, how expensive are these CT scans?
Luckily now we are fortunate that at least now the government of Uganda has tried to put different cities in different referral hospitals or national referrals, such that people can easily access now CT scans. You'll find that different referrals, most of them have been installed with CTs and some MRIs. So you'll find the prices of the CT varies depending on different places. Also in private sector, there are also CTs, but I'll usually in referrals, the city will range from the, let me say, non-contrasted. It's just around 150,000 for a non-contrasted city to be done. 150,000. So the price will be varying in different private sectors. But in referrals, you'll find that the price of the city will start around 100 and 150.
Okay. And lastly, what's the waiting time after scan is done?
Usually, the scan will take 10 minutes
Wow,
when you
that's
scan
fast.
the patient.
That's
10
fast enough.
minutes. Now, currently, we have different slices in cities which are very faster.
Yeah.
So you'll find that the scan will be done in 10 minutes. Then
Okay.
it will take like generally 20 minutes when the results are out.
Okay.
We finish scanning the patient because the patient, once it's scanned, the patient is taken and the results are being printed and they are given to the. Currently, we have also that images, you'll find some departments where images are no longer being handed over in hard copy. There is teleradiography, what
Yes.
we call teleradiography, where images in ER, they have monitors where once you scan like this, images
Yeah.
are already there in ER, and the radiologist is there to interpret and give the proper diagnosis to the patient.
Okay. Uh, Thank you so much, Julius, for this discussion, and we shall be having you another time, another day. Each time we need to have consultation from the radiology department. Send our regards to everyone in the radiology department. On that, do you people normally get results in time? And how important is actually the radiology to you people that are managing? I know you're public health specialist, but how is radiology important in the overall management of these? How important is actually the radiology to you people that are managing? I know you're public health specialist, but how is radiology important in the overall management of these?
I would say radiology is very important. Like he mentioned, CT scan helps us to actually confirm that this person is getting a stroke. The picture that the um, CT people are going to interpret, it will help to actually confirm to the clinician that this person is going into a stroke. And then the MRI is very important in confirming any ischemia, any ischemic, in case it is an ischemic stroke of early onset, especially. This MRI is it's very helpful in detecting it.
Okay.
Yeah. Yes, and then in case maybe this may be supportive, it may not necessarily be confirmatory or very necessary, but an EEG may also be used to detect if there are any seizures that are going on in the brain, and
Yeah.
we would like to have intervention there as well. Then the other thing, ECG echo may also be of use, especially to help us establish what the origin or the source of the clot, in case it is an ischemic stroke, what the origin may be. So it may be useful as well. But as he mentioned, the CT is the most helpful confirmatory.
So what should I do immediately? I don't know if you answer this. What should one do immediately if someone shows stroke signs?
Like I mentioned earlier, it is an
Yes.
emergency. Stroke is an emergency. Okay. Yes. Like I meant, want to lose any time. The more time we lose, the more brain cells that are actually suffering and probably have getting dead brain cells. So we do not want to have as much impact on this brain when we are not having any intervention being put in place. So as soon as someone is seeing signs, those warning signs, it is urgent that they go to the hospital to seek treatment as soon as possible. I can't
Or
emphasize it enough. Time is of the essence.
Um, again, we have a challenge of different health facility levels. We have drug shops, we have clinics, we have medical centers, we have hospitals. What would you recommend as a public health specialist? Should I go to the nearest clinic? Should I just drive straight to a medical center? Should I go straight to a hospital? If given that, because we also have a challenge that some clinics, if you enter them, they have capacities to be medical centers, and some medical centers, if you go them, the capacity is almost a hospital. But assuming everything is done right, which level would you recommend this patient or person to go?
Hospital.
Hospital.
Hospital, because many of the interventions that we are looking at, including these tests that we are recommending, the
Mm,
radiology, the CT scans that we are asking for, the MRI, they are done at a hospital level. So if you check in into a health center, unfortunately,
mm,
you will not be able to get these investigations done and some of the interventions that are necessary. So it is necessary that the person is taken to a hospital immediately, not a nearby health center or medical clinic. Hospital.
is stroke preventable? If so, how?
I think when we are looking at prevention, we would want to manage the underlying risk factors.
Okay.
So, meaning we are going to look at our lifestyle. If there are
Mm,
things that one is doing, for example, the smoking,
mm,
the inactivity,
mm,
the drug use, the alcohol
mm,
use, those are things that are in our jurisdiction to actually manage, to
mm,
prevent and have them off our list as risk factors. Then the underlying medical illnesses. For
mm,
example, if we are having someone with high blood pressure, we want to make sure that this person is having their pressure controlled, be on
mm,
medication, make sure that it is within the correct ranges, the
mm.
advised ranges. Then for people with diabetes, to make sure that it is controlled as well. In a nutshell, all the underlying medical illnesses need to be controlled in order for one to reduce their chances of actually getting this stroke, that including the sickle cell disease as well.
Okay. For so many for so many visitors that I've hosted here, there is always a relationship between lifestyle, diet, exercise, and stress. What could be the impact of these triplets? That is diet, exercise, and stress on the likelihood of someone having stroke.
Unfortunately, those three are culprits when we are talking about non communicable diseases. Unfortunately, when it comes to non communicable diseases, these
Mm,
three culprits are always at the forefront. Any of them, most if not all of them, can be managed or prevented or controlled if these three are addressed. These three are going to address the
yeah.
underlying medical illnesses that will predispose one to a stroke. So,
Okay.
if someone is hypertensive, they don't want to have a lot of stress on them because if their blood pressure is through the roof, then they are at a higher risk of getting a hemorrhagic stroke. If someone is not attending to their diet as they should, we are we are foreseeing cases of hyperlipidemia. This is the high cholesterol in their blood, and it is still a predisposing factor. So, in one way or the other, these two are intertwined. And when we are looking at risk factors, we cannot ignore them.
Um, is stroke hereditary? Should I screen my wife before I marry them for stroke?
No, it is not. Stroke is not hereditary. However, the underlying conditions that we are looking at, some of which may predispose you, history, family history may
Mm,
predispose you to getting them. But I cannot necessarily say that because someone's parent had a stroke, then even their child will have a stroke. There is a predisposing factor when it comes to the underlying medical illnesses. If we are looking at hypertension or diabetes, family history is relevant in that matter.
okay.
We will suspect, but still, it's not a given that if it is in your family, if it happened to the generation before you, then it's going to happen to you. Because again, these many of the risk factors are modifiable. If we are having our stress in check, our physical inactivity in check, our diet in check, working out, and managing any other things that may predispose us, then it is very likely that we can actually effectively prevent it.
You've talked about early detection, going for CT scan early, reporting to hospitals early. So what is how easy is it to manage stroke in a hospital, and what treatment or management options do we have?
I may not go very much into the detail, but I can give a
Yeah.
public health overview of the
Mm.
treatment. If we
Yes.
are looking at treatment, we are going to be managing basing on what the cause is. If
Okay.
someone is having ischemic stroke, we are going to be looking at making sure that that clot is removed. So there may be embolytic therapy. Yes, like I mentioned, if we are managing stroke from the
Mm.
public health point of view and
Yeah.
slightly clinical information, I can say that we are going to be targeting what the cause is. If it is a hemorrhagic stroke, we are going to be looking at making sure that this person's blood pressure is in check. Whatever the cause of the hemorrhage is what we are going to be attacking and making sure that we remove the cause and salvage whatever is left of the brain cells. If it is an ischemic stroke, then we are going to make sure that this clot is removed. So you'll see cases where thrombolytic therapy is being given to this individual. But in some severe cases, surgery may be required. It can be both for ischemic or hemorrhagic. In case the cases are severe, we may be looking at surgery as an intervention to see that
Okay.
this is managed effectively. Yes. But
Okay.
also, if the cause is removed and we have now controlled the person, there is no more brain cells that are at risk of dying, then we are going to rehabilitate this person to see if they can be able to reverse some of the damage. Part of rehabilitation is to help the body reverse some of the damage that has already been done. If not, we are trying to see that this person is able to manage their body function given the changes that have been brought by the brain damage.
Okay. Talking about recovery and rehabilitation, what is the typical recovery process after stroke?
I can say we are going to look at different aspects in which we are rehabilitating this individual with the medicine being given and the interventions being applied to control whatever the cause is, we are going to look at the preventive aspect as well. For example, for cases of people that get clots, we may
Mhm.
have someone's clot that could travel to the brain and we get another stroke happening sometime later. And then we are when it comes to rehabilitation, we are going
Mm.
to look at different forms, different ways in which we can rehabilitate this person. So we are going to look at the cognitive part where we are trying to abilities, maybe their level of concentration or their memory, to see that they find a way of getting back or recovering to a certain degree that is helpful to them. Then we are also going to look at occupational therapy.
Yes.
Occupational therapy is going to help this person do some minimal activities that require body movements here and there. But on a larger scale, we shall also look at the physical therapy where we
Mm.
want to strengthen this individual's muscles. It could be the arms, it could be the legs. And then another rehabilitation aspect that we could look at is the speech therapy for
Mm.
someone to actually be able to regain their speech. And in some cases, there are some lucky people that have been able to recover all their abilities
Mm.
and be functioning normally. They get back on their feet, they are able to speak properly like nothing has happened. Yes, as saying, unfortunately, some people may need to be rehabilitated to a level where their body is able to function even with the little disabilities that may have come due to the permanent damage in certain sections of the brain. So they may not recover fully to 100%.
Okay, so I come again. Okay, so can someone, okay, can someone fully recover from stroke with timely and proper management?
Yes. Yes,
Okay.
like I mentioned earlier, we've seen cases where people are able to actually recover all their abilities, the movement, the speech, the cognitive abilities, and be able to function well. So yes, we've seen cases of timely, rather of full recovery, but all this is on the basis of timely intervention. If people get treatment or management is initiated as soon as symptoms have begun rather,
Mm.
then we are able to look at to think of or expect a full recovery.
Okay. Um, what complication should or long-term effect should one expect after they have been diagnosed with stroke?
We've
Yes.
seen people that actually are stuck in the wheelchair
Okay.
because they have lost the muscular strength, the movement in their muscles or in their limbs. There are people that have a part of their body that is completely not able to function. There are people that become incontinent.
Mm.
They are not able to go to the
Control.
washroom as
Oh,
and
yeah.
when. Yes, they are not
Mm.
able to control that. Then yes, like I've mentioned, it's those cases that we have seen people that are stuck in the wheelchair for life. Some people
Mm.
end up losing senses from their waists all the way down. Some
Mm.
people end up losing ability to function in a certain part of their body. It could be a left part or the right part. Yes.
Is that what you call a hemiplegia something?
Sometimes we may look at people losing abilities in parts of their body.
Mm.
Some could be less, others could be more. We've
Okay.
seen scenarios where people are quadriplegic, and here they are not able to use any part of their body. They can't use their limbs. They can't use any part of their body really, and it's
Mm.
a side effect from certain permanent damage in the brain. We've seen
Okay.
cases where someone has lost ability in only half of their body. It
Mm.
could be either the left or the right half, or
Mm.
someone has lost their ability from the waist downwards. We've
Mm.
seen those cases. And then
Mm.
some people in the process end up becoming incontinent. They are not
Mm.
able to control their bladder and bowel functions.
Okay.
Yeah.
Y- Yeah, maybe also my experience, I've seen some people lose their sensory changes that they can't see properly with either one eye or both. I've also seen some people struggle in their speech and language abilities where someone can no longer now, someone who used to sing can no longer sing. I've also seen also some people struggle with the swallowing because maybe the nerves that are responsible, the part of the brain that is responsible for swallowing has been affected. And also their emotional disturbances because now someone who used to do their own things now needs someone to assist them do certain things. And so it ends up actually nga bafunye obuzibu obw'amaanyi bawulira abamu nga obulamu bulinga obuweddewo and be bano abantu mu society ffe tugamba nti gundi yafaako oludda olumu. That's a term that is normally used. Anti gundi yafaako side eya kkono oba eya ddyo. And also for women, sometimes it becomes hard for them to conceive because then there are a certain uh, certain pelvic muscles relax, that now the uterus can no longer contain or carry the baby to term. Flavia, lastly, as we finish this discussion, I normally always want to end this discussion with something on mental health. What kind of emotional or mental health support is available today for people who have stroke?
The support that is mostly available is rehabilitative, really. Like I
Mm,
mentioned earlier, we look at the physiotherapy, we look at the speech therapy. You mentioned some of those changes and effects that could happen. So we look at speech therapy for people to be able to actually compose sentences and be able to talk and communicate,
yes.
and we also look at the physical therapy is the
Mm,
one that is really to strengthen their arms and legs, to be able to strengthen their muscles, really. Then we look at the occupational therapy, and here we want to enable them to be able to make certain movements from time to
mm,
time that are
mm,
basics in their natural way of living, really. Then the cognitive part is targeting their mental abilities to concentrate, to be able to coordinate different things. And counseling as well is a significant part of this rehabilitation or
mm,
management for these people, because it cannot be easy for someone to wake up one morning and then they don't have control over their bladder and bowel functions. Certain things are traumatizing mentally, so
mm.
counseling is a very significant part of the help that is given to these people to help them try to adjust into the now, despite of what has happened or their previous way of life or their previous bodily functions. But now that this has happened, this is what is going to be there. This is what to expect. Here is how to go about it and get used to what circumstances have led them to in that moment and improve their quality of life as is.
Okay. Um, as a public health specialist, how can caregivers support these stroke survivors? What's the best way? If you are called to speak to caregivers or people that have been through stroke episodes, how would you advise them to talk to help these people?
First of all, I would advise them to understand their
Mm,
condition,
yes,
how it came about,
yes.
and understand and acknowledge the fact that these people will not be able to function normally the way they have been functioning previously,
Okay,
and then equip them with how best to help them.
okay.
We've had scenarios of some people that are in catheters, some people that are put in diapers. This person is going to need help in everything. Some people
Mm,
need help even to the extent of feeding them.
mm,
So, unfortunately, sometimes it takes a toll on these caregivers as well, because you
mm,
have to bathe someone, you have to clothe them, you have to feed them, you have to change their diapers, you have to move them. Sometimes it can be a lot of work. So
mm.
this counseling is necessary not only for the patient, but for the caregiver as well. They need to be part of that counseling session on what
Mm.
to expect and how best to help this person.
Okay. Are there some support groups or community resource that you know that for people with stroke or people that have had stroke? Do you know any supportive groups? And you feel there is need to create some if we have none in Uganda right now?
Support groups, I am specifically interested in the idea of support groups because I've seen them work. But
Mm,
from my experience, I have not yet noted any support group for stroke patients. I've not come across any, but it could be there. I can't dispute it. I have rather seen more cases of support groups of some other non-communicable diseases like hypertension and diabetes, where people with the same illnesses are coming together for peer support to encourage one another on what the condition is, to encourage one another to remain on medication and have their illnesses controlled. And yes, they are very helpful. I'm not sure if the ones for stroke are there, but they would be very helpful for people to come together with a similar uniting condition and share experiences and encourage one another really and identify with each other to know that it's not the last part to death really. You can move on, you can have a modified quality of life. It may not be the best, but you can have a certain level of quality of life to keep on pushing. My closing remarks, like I mentioned in the start, I am very, very interested in the idea of, in rather in interventions that are directed towards non-communicable diseases, preventive measures, management, and rehabilitation thereafter. It's very, I'm glad you have invited me to be able to share on this NCD. And I wish to just let the community out there know that many of these things, many of these conditions are actually preventable, and we are at the forefront. Us, the individuals, are at the forefront of preventing these conditions, of managing, of taking care of ourselves to prevent, because when we look at stroke, it's usually a complication of some other condition. A complication, it can be a complication of sickle cells, it can be a complication of hypertension. So I encourage, if you have any underlying condition, please have it managed, have it in check, have it controlled, know the hows how to um of how to keep it in check, the what things to do, the what not to do, and ensure that your quality of life is improved even as you have this condition, such that we avoid complications that may lead to even more adverse effect and permanent life changes. Thank you once again for inviting me. It's a pleasure to be able to share my 1 cent on what I have on any of these. And thank you for watching.
Okay, thank you so much, our dear guest. Again, as we have seen today, stroke doesn't wait, and neither should we. It can happen to anyone, anytime. But with the right knowledge, fast action, and early treatment, lives can be saved and futures can be protected. Let's remember the signs first. Face is going to drop. Your arms may become weak. You may have speech difficulty. Time to call for help, because every second counts. So each time you have those symptoms, please call help. Thank you, our guests, our viewers, and to everyone out for taking steps to stay informed and to be proactive in managing stroke. My name is Mr. Selfcare, and on behalf of the team here, stay safe, stay aware, let's keep the conversation going. And until next time, take action and take care. Have yourself a good day. God bless you. See you next time.